Today we're talking about a med that every paramedic doing RSI should know, Rocuronium. What it is, how it works, and how you should be using it in the field. Now, Rocuronium is a non-depolarizing paralytic, so let's break that down real quick.
What does that mean? Well, it's the opposite of succinylcholine, which is a depolarizing paralytic.
This is an aspirin. You can tell that it's an aspirin tree because of the way it is.
What that means for us is Roc's not going to cause the same fasciculations that succinylcholine does. Now you might be thinking, isn't Sux better because it works faster? And it does sometimes.
Succinylcholine's onset is super fast, about 60 seconds. But at higher doses, Rocuronium's onset can be just as quick, also 60 seconds, without the plethora of contraindications that come with Sux. The only true contraindication for Rocuronium is history of allergic reaction.
So what's the dosing for Roc?
Rocuronium, when given at a dose of 0.6 to 1.0 milligrams per kilogram, has a duration of about 20 to 30 minutes. Bump that dose up to 1.2 milligrams per kilogram, and you're looking at up to 90 minutes of paralysis along with that 60-second onset. It's most often in a 100 milligram per 10 milliliter vial, so for an 80 kilo patient, we'll be drawing up and administering 8.6 milliliters of Rocuronium.
So why choose Rocuronium over succinylcholine? Well, it depends on the situation, but it's all about safety.
While succinylcholine can cause some pretty gnarly side effects like hyperkalemia, bradycardia, and malignant hyperthermia, Rocuronium is a much cleaner option. Think about patients with muscular dystrophies, renal failure, burn victims, acute trauma, or those with a history of malignant hyperthermia. Also, patients with increased intracranial pressure or known hyperkalemia. Rocuronium is your go-to.
The likelihood that your patient has an undiagnosed neuromuscular disorder may be low, but effects can be disastrous if Sux is given in these cases.
As demonstrated in a retrospective study that logged cases in which patients with Duchenne's, some before they were diagnosed, were given succinylcholine during anesthesia.
And here's something else important.
A NEAR study found that there's no significant difference in first-pass intubation success rates between Rocuronium and succinylcholine. So it's not like you're sacrificing effectiveness by choosing Roc.
One thing to always keep in mind, especially with Rocuronium, sedation, sedation, sedation.
We already know that analgesia comes before any paralytic administration, but we also need to keep in mind that since Rocuronium lasts longer than Sux, your patient needs to be adequately sedated throughout the 90-minute duration.
So let's do a quick recap.
Rocuronium is a non-depolarizing paralytic with a flexible onset and minimal side effects. It's great for patients where Sux could do more harm than good. Just remember to keep sedation going.